All right, today we're cracking open two real-life medical case files. We're going to step right into the high-stakes world of diagnosis, where every single clue counts and the clock is always ticking.
So, I want you to think of this as a challenge. I'm going to lay out all the evidence for you piece by piece, exactly how a doctor would get it. Your job? Follow that trail of clues and see if you can figure out the diagnosis before we get to the big reveal.
'Cause let's be honest, that's exactly what this is. It's medical detective work. Doctors are basically investigators, right? They're using science, they're using observation, all to solve these life or death puzzles happening inside the human body.
So in this explainer, we're going to look at two completely different patients, each with a super mysterious illness. But the one thing they have in common? It's that same methodical process of discovery that, spoiler alert, ends up saving their lives.
All right, let's dive right into our first case file. We've got a traveler, and as you're about to see, where he's been is a huge first clue in this whole investigation.
Okay, so here's the rundown. A 38-year-old guy just got back from Angola, and he is really, really sick. He's showing all the signs of a severe body-wide infection. We're talking high fevers, body aches, and a rash on his chest. But look, there are two things that really jump out at the doctors during his exam. First, jaundice, that yellowing of the skin that screams liver trouble. And second, conjunctival suffusion, which is just a fancy way of saying he has seriously red eyes.
Okay, the first labs are in, and boom! We have a critical piece of evidence. His platelet count is down to 78. Now, normally you'd want to see at least 150. Just think of platelets as your body's little emergency repair crew for stopping bleeding. This guy's crew is at less than half strength. That is a massive red flag. It means his blood isn't clotting right.
And the next clue? It totally confirms what we were thinking about his liver. His AST, which is a key liver enzyme, is at 320. Now, to put that into perspective for you, the normal range tops out around 40. So yeah, this isn't just a minor issue. His liver is taking a serious beating.
All right, so when we look at the whole panel of tests, a really clear pattern starts to emerge. His white blood cells and hemoglobin are low, his bilirubin is through the roof, that's our jaundice right there, and his creatinine levels tell us his kidneys are starting to fail. This isn't just one problem. It's a full-on, multi-system crisis. This thing is hitting his blood, his liver, and his kidneys.
So, the team is scrambling, they test for all the usual suspects from that region, malaria, dengue, hepatitis, and they all come back negative. But then, one test hits. It's the smoking gun. A very specific test for an antibody for something called leptospirilla comes back positive. We've got our culprit.
So what in the world is leptospirosis? Well, it's a bacterial disease that you typically get from contaminated water or soil. And when you look at it, it perfectly explains everything we're seeing. The fever, the liver and kidney failure, even the red eyes. It's like a textbook case, especially given his travel history to Angola.
And this is a perfect example of why getting the diagnosis exactly right is so critical. The right move here is an antibiotic called doxycycline. It's like the perfect key for this specific bacterial lock. If they had given him artesunate for malaria, totally the wrong key. It wouldn't have done a thing. Even ceftriaxone, which is another antibiotic, would have been like using a sledgehammer when what you really need is a scalpel. See, a precise diagnosis leads to a precise treatment.
All right, let's switch gears and open up case file number 2. Now we're going to see that exact same diagnostic process play out, but the mystery itself, it's completely different. This time, it's not about something he picked up while traveling. This is about a super aggressive invader that's taking advantage of a weakened defense system from the inside.
Okay, so our second patient is a 45-year-old woman. And right off the bat, two huge details jump out from her chart. She has type 2 diabetes, and she was recently on high-dose steroids. Now, both of those things can really hammer your immune system. And her symptoms, they are really alarming. And they're all focused on her head. We're talking a severe headache, swelling in her face, and her left eye is literally bulging out.
Then, during the physical exam, the doctors find it. The single most important clue. They find this black, dead tissue, it's called an eschar, right inside her nose. You guys, this is a terrifying sign. It means that whatever is in there isn't just causing an infection, it's actively eating away and destroying her tissue.
Our quick blood test gives them another massive piece of the puzzle. Her blood sugar is at 22.5. Wow, that is dangerously high, a classic sign of uncontrolled diabetes. And this kind of high-sugar, acidic environment, especially when you add in her weakened immunity, has basically created the perfect storm for a very, very specific kind of nasty infection. So, to be absolutely sure, the doctors take a biopsy, a small tissue sample from her sinuses. And under the microscope, they see exactly what they were afraid of. This very specific description you see here, broad, non-septate hypha with right-angle branching, that is the unmistakable fingerprint of a very specific, very aggressive group of fungi.
And the diagnosis is in rhinocerebral mucormycosis. This is just a devastating fungal infection that starts in the sinuses and can just tear right through to the eyes and even the brain. It's a true medical emergency, and it absolutely loves to attack patients exactly like this one, people with uncontrolled diabetes and a compromised immune system.
And just like our last case, getting the treatment right is literally everything. The only thing that works against this particular fungus is a really powerful IV antifungal called amphotericin B. If they had used a common antifungal like fluconazole, totally useless, wouldn't have touched it. And using an antiviral like acyclovir, that's like bringing a water pistol to a wildfire. You have to know exactly what enemy you're fighting to choose the right weapon.
So, wow. After racing through those two really intense, down-to-the-wire cases, what can we take away here? What's the fundamental process of this medical detective work?
Well, it really boils down to the same repeatable pathway every time. It all starts with listening to the patient's story, right? Like our traveler who'd been to Angola. Then you hunt for those physical clues, like that black eschar in our second patient's nose. Next, you gather the hard evidence with lab tests to back up your hunch. Use all that data to nail down the suspect, whether it's leptospirosis or mucormycosis. And then, finally, you pick the one correct treatment to take out the thread.
And all of this really highlights a fundamental truth about medicine, and it was captured perfectly by the famous physician William Osler. He said, "Medicine is a science of uncertainty and an art of probability." It's not always black and white. It's about gathering up all the clues, weighing the probabilities, and then making the best, most educated decision you possibly can. It's this amazing blend of hard science and, really, a practiced art. And that kind of leaves us with one final thought to chew on. In the story of your own health, you are the #1 witness. So if your body was the setting for a medical mystery, what's that one critical clue? That one little detail, that nagging symptom you've been ignoring? What's the one thing you would absolutely want your doctor to pick up on first?